how do I know if I'm ready to do all sorts of stretches? I'm starting to feel good. My back is feeling good. How do I know it's safe now to return to, non-restricted, like not being careful about how you position your back, how you're lifting? When I say not be careful, but we're stretching to other directions. Let's say you were someone that was involved with yoga or different activities that required a lot of forward flexion or movements like that. How do we decide that we're ready to go? Okay. Just wait a little bit longer. I'm going to show you the movements we're going to do, but let me explain something. Most people that I treat for lower back conditions, more commonly, they have a loss of motion going this way. So the exercise we give them is typically some kind of form of arch or side bend or movement in this direction. Most people, a lot of people, because we sit a lot, lose that motion, and that can contribute to back conditions. So a lot of times we're giving either a back exercise like this, like a press up or some form of it, a standing arch, something like that, and that's the exercise. And I'll tell people, do it like 10 times every 2 hours. At a certain point, the people that respond to it, and not everyone responds to it, but certain people respond to it, then we want to test it. And this is the scenario. They'll say, it's been about a week, my back's feeling pretty good. They seem to have pretty good range of motion. They actually, sometimes people come in here and they could barely get past here, and this is pretty good range of motion. I can't quite do it with my ankle boot on right now, but this is pretty good range of motion. They're feeling good. They say, I've returned to most things, but they say, am I ready to return to everything? Is there any restrictions? How stable am I? Am I ready to go? And I'll say, well, let's test you. Let's see if you can do the opposite direction. Let's start working on flexion. Flexion is typically bending over to tie your shoes or doing any kind of form of yoga stretches where you're forward. And I'll say, let's go ahead and check that out. So the first thing we do is we start, most times, is we'll first start with doing a knees to chest. Because this is a non-weight bearing position, is typically a little safer. Lean back, you're gonna go pressure on, pressure off. And all we're trying to do is flatten out that lower back and test it. Okay, all the way back, pressure on, pressure off. If they feel pretty good with that, I'll have them stand up. I'll see how their motion is. Feel pretty good. They said, Tom, I feel good. I don't feel any, my pain hasn't returned. I feel pretty good. Then I'll have them do a seated version of it. Sometimes I'll have them do the knees to chest first. In certain cases, I'll have them do the knees to chest, and then I'll work on a seated version of this. So the seated version is simply coming to the edge of the step like this or seat like this, hands like this, and we'll simply have them come forward, pressure on, and then pressure off. There's different versions of this, but this is one of the ones I use. Pressure on, pressure off. And I'll have them do it for 2 or 3 days. If they feel like, wow, I've been doing that, I haven't lost any motion in any direction, like you'll notice that even when they do that, they still have very good range of motion here. The people we have to be careful for is after they've done that stretch, the knees to chest or the seated one, you'll see that the ones that you have to be careful about, they'll say, wow, I'm losing this motion. I can't quite get it back quickly. Or I start developing that lower back pain pretty soon after that. That's a sign that you're not ready to stop the arches, the ones on your stomach or the standing arches like this. Okay, so just keep that in mind. That's what, and the formal name is Recovery of Function in the McKenzie Institute. They want you to test it. So we know when you leave our clinic, we've tested you enough that we know, you flex the spine a little while, and then once you get to that point, then we're pretty comfortable that you're ready for discharge, at least from the standpoint of doing any kind of flexion. If we have any kind of strength deficits, we'll address those as well. But that's what we want. That's what you have to do to kind of test it. So if you're at home and you want to do a self-test, that would be some of the things you would do. If you've been doing the arch, you've seen on some of my videos, or the prone press with the one on your stomach, some people refer to it as a cobra, and you're feeling pretty good, but you're kind of nervous. You're like, well, should I really go back to everything I want to do? You may want to test it out first for 2 or 3 days, doing the knees to chest. Same idea, 10 times every 2 hours, about 5 sessions a day, and test it out. Do your symptoms come back? Okay. And if you do it in a controlled manner, like I'm describing, doing that or the one in the chair, and you do it gradually, and you start having trouble, you'll know you're not quite ready to stop doing the extensions and arches and those exercises, or it could be another version of an exercise they gave you, but it's a good way to test it in a controlled way. Much better than going to the gym and doing a bunch of crunches or doing a full yoga class where you're doing a lot of motions and maybe you're feeling like I shouldn't stop. It's a good way to test it. So it's a great self-test. Is your back better? That should be the mantra. Is your back better? That's how you test it. Okay? Share this to a friend, because you in life, you should be able to flex. You should. Your body is meant to lean over. You can't always maintain a perfect lower spine. You might want to move back. Lower spine like this. You can't always get to everything on the floor by having your perfect position. A little bit of an arch here. When you can, it's better, but you do have to flex forward to grab your shoes, your toes like that, to get your shoe on, your sock on, to get out of bed. Sometimes you gotta reach for the sheet or move it over. So life is not just arching all the time. If you're really getting better, you should be able to do this movement, but first you should test it and regain that motion. Hope this helps you out. We want you to have a smooth recovery. So remember, if you're doing those arches, don't forget to test it before you go ahead and go back to everything. You've got to see how stable it is. Is it really feeling better? Is it really healed? I would say the rule of thumb is somewhere between, and it varies depending on the person, 5 to 7 days, maybe 3 to 5 days of doing that stretch to see if it's all right. Typically, you start that after you haven't had much back problems for a good week. Then you should try and do this program. Then you start it. After doing that flexion, doing the knees to chest and the seated flexion, if you do that for 2 or 3 days, upwards a week, it doesn't bother you, guess what? You're home free, and hopefully we took care of your back problem. But realize, watch the back. If you've ever had a back problem, the second time it happens, statistics show it's worse. So you really want to catch it early. If you start having symptoms again, you start having back pain or difficulty, or it hurts when you cough or sciatica, go back to the original exercise that helped you in the first place. Okay? Hope this helps you out. Have a great day.